Hello everyone, I am Dr. Aparna, Consultant Neonatologist and Pediatrician from KIMS Cuddles Hospital, Hyderabad. It is monsoon season already and it is important for us to identify and manage how we can treat fever in children. This is one season when kids are vulnerable to infections such as mosquito-borne infections like malaria and dengue, as well as viral infections such as flu. The most important step is to remember as parents that we need not panic when the child has fever. Now, fever should be confirmed using a thermometer, and mere palpation or touching the child's skin may not be enough to confirm the presence of fever or to assess the severity of fever. So, please have a thermometer handy at home. Now, if there is fever, very important step is to ensure that the child is well hydrated, ensure adequate intake of liquids which include water, it may be milk or other readily available homemade liquids such as buttermilk, coconut water, vegetable soups in order to ensure good urine output. If fever is significant, along with the advice of your pediatrician, you may use oral suspension of paracetamol at the right dose that is recommended by your doctor. The typical dose of paracetamol is 15 mg per kilogram, and this can be repeated at a gap of 6 hours usually, provided the child has fever again. In cases where fever is coming recurrently, we may repeat it earliest at a gap of 4 hours. In cases of high grade fever, there are other options usually that are given, such as a combination of ibuprofen and paracetamol that is available as ibugesic, or one may use mefenamic acid. Although there is not much of research comparing the two, generally it is considered that ibuprofen paracetamol may work both more effectively and more safely. While doing all these steps, it is important to ensure the safety of these medications, ensuring that the right dose is given, and make sure that you are aware of the strength of the syrup of paracetamol that you have. Now, oral drops of paracetamol have a concentration of 100 milligrams of paracetamol per ml, whereas suspensions of paracetamol come in varying strengths such as 250 milligram per 5 ml, or some may have 125 milligram per 5 ml. So, it's very important that you ensure that the correct dose is given to the child. Now, in case the fever recurs before the ideal time for the next dose of paracetamol, say for example, even before 6 hours has lapsed from the previous dose, if the child again develops high degree of temperature, you may try sponging of the child, which is called tepid sponging of the limbs, the hands and the legs with warm water. This can be done over a period of 15 to 20 minutes, and evaporation of water from the skin allows cooling of the temperature. But do remember that if the child has any danger signs such as high degree of temperature, particularly more than 101 or 102 degree Fahrenheit, or if fever is associated with excessive drowsiness or excessive irritation, decreased intake of milk or decreased intake of food, and not passing urine at any point of time for more than 6 hours at a stretch, this calls for immediate medical attention, and please don't hesitate to reach out to the nearest hospital emergency. Thank you.